Psychiatric Mental Health Nurse Practitioner Supplement, Abridged. Copyright 2021, Marilyn L. Tidwell Shoemaker, Doctor Nurse Practitioner, Psychiatric Mental Health Nurse Practitioner, Board Certified. Disclaimer: this material is not the full extent of information you may need for successfully passing the ANCC exam. The contents herein are tidbits of information gleaned from several publications, like a meta-analysis in the literature. According to Pele, success is no accident. It's hard work, perseverance, learning, studying, sacrifice, and most of all, love of what you are doing or learning to do. Exam tips. Review the handbook at nursingworld.org. It has everything you need to know about how to take the test. Know where the test is. Make a dry run ahead of time from your home to the testing site to make sure you know that you can get there on time. Control your anxiety. Ignore what others say about the test, because, like the old saying, one man's trash is another man's treasure. Someone may find one portion of the test extremely difficult and might skew your perception of the test, when in reality, it's quite easy for you, that particular section. Remember, it's an entry-level test. Common issues. Know the most common psychiatric issues. Know the most common treatments, including meds and contraindications between meds. Assume that all drugs in a class are alike. Know the differences among the common drugs. Emphasize safety and the least powerful meds. Let's think about you. Be sure to get plenty of rest. Eat healthy. Stay hydrated. Most important, do not study for more than 1 hour at a time. Get up and take a break. Use a timer if you have to. Augment your current knowledge. Look for sample test questions online. Again, nursingworld.org. Use your university's library. Conduct a little bit of research. Take a review course, and remember, it's not a waste of money if it reinforces what you already know. So what do you need to know? Use the ANCC test review materials. Read your textbooks. How do you study? Do you study in a group or alone? Here's a tip. To reinforce what you already know, teach someone who does not know. Teach it at the lay level so that it will demonstrate to you what you already know, and it'll also highlight any areas that you are deficient in. Make a slideshow if necessary. Don't cram. Remembering things does not occur when you cram. Make sure that you study over and over again. Textbooks? Do you still read them? Scope and standards. Know your scope and the national standards. The ANA is a great resource. Know all the body systems from head to toe. Know how to do differential diagnoses. Know how to make a plan of care. Okay, it's exam time. We highly recommend that you stay in a hotel the night before the exam if you live more than 30 minutes from the testing site. Make sure you have a plan B for getting to the test site, because sometimes vehicles break down. Arrive 15 minutes or more early for the test. Relax and slow your heart rate. Take a couple of deep breaths. Do not study the night before the test. Either you know this or you don't. Be sure to avoid alcohol or sedatives because you don't want anything to upset or mar your ability to recall information. Types of questions. The test is computerized. There are 175 multiple choice questions. But remember, 25 of those questions you probably won't know anything about because those are test questions the testing agency puts in there to gauge what to put on the next test. Read the test instructions and understand them completely. The basic rule of good test taking is read the question first, not the background information. Read the question first. Look out for red herrings. These are detractors that will lead you astray from what the actual test question is. If there are two correct answers, one will always be more correct than the other. There are 4 possible answers. It's a multiple choice test. 2 will definitely be incorrect. There is no missing information in the background data for any question. Know the facts, apply the facts, and differentiate between the possible options. There are keywords on the test. Some of these keywords are avoid, best, accept, not, initial, first, contributing to, appropriate, most, significant, likely, of the following, most consistent with. So, how do you choose the best answer? Again, read the question first. Read the background details. Watch out for red herrings. Ignore the 2 incorrect answers. Reread the question and don't be distracted by something like an intervention when they're asking for an assessment. Marking your answer. Only one answer is correct. And if you don't know which one is correct of the 2, guess. You got a 50-50 chance of getting it right. Don't change any of your answers unless you know absolutely for certain that you made a mistake. Pace yourself. You want to try and finish the test. Trust your instinct. You'll need to know about regulatory issues. The governing concept about nurse practitioners is called LACE, L-A-C-E, licensure, accreditation, certification, education. The 4 pillars of nurse practicing is clinical nurse practitioner, nurse midwife, and nurse anesthetist. Know your scope of practice. It determines and limits your activities. Know the Nursing Practice Act for your state inside and out. The ANCC is a certifying body for your practice. PMHNP roles. One of your primary roles as a psychiatric mental health nurse practitioner is leadership. You must advocate for the client. You must be reflective on your practice. Ask how you can do better. Your job is also conflict resolution, negotiation, mediation, and professional civility. You also must be a critical thinker. There are core competencies. Again, know the National Nurse Practitioner Core Competencies. Know scientific foundations, leadership, quality, and practice inquiry. Know about technology and information literacy and policy. You should also know about various health delivery systems, ethics, and independent practice. Specialty competencies. Health promotion, protection, disease prevention, and treatment, assessment of related psychiatric conditions, diagnosis of the client's health status, how to make a care plan and implement treatment. You need to be sure that you know how to foster a good nurse practitioner client relationship. There are specialty competencies like teaching and coaching, your professional role, managing and negotiating healthcare delivery systems, monitoring and ensuring quality healthcare practice, and cultural competence. You have professional responsibilities like confidentiality. Read about the Medical Record Act of 1995. Know about the Hippocratic Oath. Heed the High-Tech Act, Health Information Technology for Economic and Clinical Health Act. You must also know about HIPAA. Brush up on your HIPAA rules and requirements. When it comes to telehealth, especially since the COVID-19, it's important to remember that all of these professional responsibilities apply to telehealth. You need informed consent. The client needs to know their rights, and you must be ethical in everything that you do. Now, here are some important considerations about ethics. Ethical decision making. You should always keep in mind what is best for the client as your first decision-making process. Make sure that you understand what a conflict of interest is, and make sure you know that you must disclose any conflict of interest. There are legal considerations, malpractice, competency. Now, one of the things about competency is only a court can decide whether or not one is competent, whether it's the nurse practitioner or the client. You must know about commitment, involuntary admission, voluntary admission, insurance responsibilities such as malpractice assurance, mental health care quality. Don't forget the Plan, Do, Study, Act. The way it works is you see a problem, you plan on fixing it. Go ahead and fix the problem. Study how did it work and where did it not work, and then act accordingly. If it worked, implement it. If it didn't, back to the drawing board. Electronic medical record keeping is becoming more and more commonplace nowadays. Don't forget HEDIS measures, health effectiveness data and information set. Organizational changes. You are an example of an organizational change. And make sure you know about the patient care model. More quality improvements. Remember, your job as a nurse practitioner is to be a mentor. Help others raise their level of competency. Be a client advocate. Promote mental health care issues by joining organizations like the American Nurses Association or the American Psychiatric Nurses Association or even the International Society of Psychiatric Nurses. Learn about healthcare policy and think about ways that you can effect change in that policy. Case management. Know about advanced directives such as a living will or a living trust. Be sensitive to cultural special populations. Remember, cultural influences and determinants of health are primary considerations when you treat special populations. Think about the homelessness. What are some of the issues that the homeless go through on a daily basis? Think about strategies you can help your client reduce the concept of homelessness. Think about migrant and seasonal farm workers and how you can help them. Sexual orientation, identity, and gender identity. Think about ways that you can help these clients. Forensics and corrections. Forensics is the application of science to evidence gathered at a crime scene. Correctional nursing. You may be called to a correctional institution to assess, diagnose, and treat inmate populations. You may also be asked to do forensic risk assessment. What are the issues that contribute to mental health issues in clients that are inmates in correctional institutions? Now let's talk about scholarly academic research. Research the literature in your practice. Understand what some of the latest things are. But when you look at studies, remember, you want to make sure the study is valid. It's viable to what you do. It's reliable and it's repeatable. That's why peer-reviewed studies are the best ones to look at. Studies must have internal validity, which means basically that the process they use to arrive at their conclusions is valid. External validity means that it can be repeated, that a third party can duplicate that study. Think about ethical considerations. Was there an institutional review board that approved that particular study? Remember PICO: population, intervention, comparison, outcome, and the amount of time it took to do that particular study. Statistics. Now, don't get all excited with angst and worry about statistics. It's not as hard as you think. There are three terms you must know the definitions of in statistics. Those terms are mean, median, and mode. Mean is just a fancy word for average. And you know how to average. You take a series of numbers, you add them up, and then you take that sum and divide it by the number of numbers that you added up. Median is just like the center strip dividing 4 lanes of traffic. It's the middle number of a data set. And then finally, mode. Mode is the most frequently occurring number in a data set. Standard deviation. Standard deviation is really simple. It's a lengthy, complex calculation, but it arrives at a number like 1.62. So what that means is, from the mean, if you add 1.62 or you subtract 1.62 from the value of the mean, that'll give you 66% probability that the next item in the data set will be within that range. And that's called one standard deviation. If you add another 1.62 and subtract another 1.62, now there's a 96% probability that the next data set number will fall within that range. And then finally, if you add one more standard deviation, 1.62 to 1.62 negative, now you have a 99% chance that the next piece of data that you look at will fall between the lowest and the highest of 3 standard deviations. It's really not that hard, especially since programs like Excel and Google Sheets have the ability to make the calculation for you. There are qualitative statistics. Qualitative statistics are those about how a person feels about something. Like, for instance, you might find a survey that says the president has a 33% confidence rate. That just means that most people think the president is not doing very well. It's how they feel about the president. Then there are quantitative statistics. Quantitative statistics are statistics you can physically and objectively measure, like how many times did something occur, or what was the blood sugar level after doing a treatment for diabetes. There are inferential statistics, which go hand in hand with qualitative statistics, because you can say that based on your intervention, people will feel better about something based on what that intervention does. Descriptive statistics are quantitative statistics. They describe exactly what happened and why it happened. Now, the probability of chance. Now, you remember when you were looking at studies and you learned a little bit about statistics that the p-value was 0.05 or less. What that means is that there's a 95% chance that your intervention did not occur because of randomness, that it was indeed occurring because of the intervention that you put in. The cutoff is 0.05. And the reason for that is that it gives you that 95%, because 100 minus 0.05 is, 0.95. Learn about the theoretical basis of care. Now, the DSM-5 tells you what the psychiatric disorder classifications are. Know about the biopsychosocial framework of care. Remember, your number one objective is recovery when you treat any client. Know about the therapeutic relationship between you and your client. Developmental theories. Erickson posits 8 states of development. Freud has his psychodynamic psychoanalytical theory. Id is the part of us that controls our drives, our instincts, and our urges. Our ego is the external reality and abstract thinking of Freud's theory. The superego is our sense of consciousness. Freud also says we have defense mechanisms like denial, projection, and so on. Freud has stages of development, and they are oral, anal, phallic, latency, and genital. Piaget has the cognitive theory, Sullivan, interpersonal theory, Maslow's hierarchy of needs, Becker, health belief model, Prochaska and Di Clemente, the trans-theoretical model of change, and Albert Bandura, self-efficacy and social learning theory. Nursing theories. Leininger, theory of cultural care, which includes diversity and university. Oram has the self-care deficit theory. Peplau, the therapeutic nurse-client relationship theory. Watson, philosophy and theory of transpersonal caring. Now let's talk about the brain, neuroanatomy. There are 2 portions to the brain. The first is white matter. White matter is the fiber portion of the nerve. Gray matter is cell bodies, dendrites, synapses, and so on. Now, the cerebrum are the 2 hemispheres of our brain. And in these hemispheres, there are lobes. The frontal lobe is the largest, and it controls our functioning and memory. The temporal lobe is our primary auditory area. The occipital lobe is our primary visual area. And the parietal lobe are the 5 senses, including reading and writing. The cerebral cortex controls our behaviors. The limbic system modulates emotions. The hypothalamus controls hunger, thirst, and circadian rhythms. The thalamus is the sensory relay except for smell. The hippocampus, our memories are via repetitive learning. The amygdala regulates mood, emotion, and connects smell with emotion. The basal ganglia regulates complex motor function. The brainstem is what connects the cerebrum with the spinal cord. The cerebellum controls voluntary movements. The midbrain is where dopamine is synthesized. The pons is where norepinephrine synthesizes. The medulla, along with the pons, regulates autonomic control centers. The reticular formation system is our primitive brain. Neurophysiology. Before talking about neurophysiology, one must understand the fundamentals of electricity because our body is a complex network of electrical impulses. Recall from science class that atoms are the building blocks of all matter. Fundamentally, an atom has three parts, which are the protons, neutrons, and electrons. Protons are positively charged particles. Neutrons are particles with no electrical charge, and both reside in the nucleus. Electrons are negatively charged particles that orbit the nucleus at different levels. Most everyone knows from playing with magnets that like poles repel and unlike poles attract. These magnetic forces are what propels electricity. Keep this fact in mind as we discuss electrons. The concept of electricity flowing through a wire is similar to the children's game of Pass the Hot Potato. In the game, children stand in a circle, pretend a small item such as a stuffed animal is a hot potato, and quickly pass the object to the next person. Likewise, materials that conduct electricity, such as metals, will allow electrons to pass freely from one atom to the next. Because atoms have electrons orbiting the nucleus, adding or subtracting electrons from one atom to another is the definition of electricity flowing through a wire. This motion of electrons occurs because of the same charge in electrons. When an atom has too many electrons, it ejects the excess electrons to the next atom. The receiving atom continues to pass the electrons to the next atom because of the alike poles' oppositional-matic force. This is similar to playing a hot potato. In our body, electrons move along the nervous system in the same way as in a wire. The nervous system. The central nervous system comprises the brain and the spinal cord. The peripheral nervous system is where the sensory receptors are, and they connect with the central nervous system. The somatic nervous system contains the skeletal muscles and the connections between these muscles and the peripheral and central nervous system. The autonomic nervous system regulates internal body functions. The sympathetic and parasympathetic nervous system is where the fight or flight concept comes from. Nerve cells. The neuron. The soma is the body of the cell. Axon are the nerve fibers that carries the electrical signal between the soma and the dendrites. Dendrites receive signals and send them to the soma. Synapse permit the electrical chemical transmission between one cell and another. Presynaptic and postsynaptic neurons are specific positions on the ends of the dendrites. Depolarization. Sodium ions flow into the soma, adding extra electrons. Repolarization. Potassium ions block or inhibit the flow of electrons into the soma. Neurotransmitters are chemical substances that transmit electrons. Amino acid combine to form protein. Glutamate is the universal excitatory neurotransmitter. Glycine, postsynaptic inhibitor for somatic motor system. GABA, gamma aminobutyric acid. That's the chief inhibitory neurotransmitter. Monoamine. That's a biogenic amine of dopamine, epinephrine, norepinephrine, and so on. Dopamine is a catecholamine. It's responsible for our pleasure. Norepinephrine is a catecholamine that excites brain control. Epinephrine comes from the adrenal gland. It's a catecholamine and makes our heart pump faster. Serotonin modulates mood, cognition, learning, and reward. Neurodeficit assessments. Computed tomography, Formerly, computer-assisted tomography uses X-rays to scan the body. Magnetic resonance imaging, MRI, uses magnetic radio waves created by the computer to image. Functional MRI images blood flow using magnetic resonance imaging. Electroencephalogram detects changes in brain electricity activity. There are three different views when you look at the body. The sagittal view divides the body in half, left to right, and it's a vertical plane. The coronal view divides the front and back. It also is a vertical plane. The transverse view divides the upper and lower half of the body. It's a horizontal plane. Genomics. Genetics is the study of individual or groups of genes. Genetic counseling is very important to the PMHNP because we have to discuss risk with the client. Genome is the complete set of instructions for reproduction. Deoxyribonucleic acid, DNA, that contains all of the biological instructions. Chromosomes are an organized packet of DNA. Genes, these are the individual units of instruction on a DNA. There are approximately 20,500 genes in one piece of DNA. Messenger ribonucleic acid, mRNA. It encodes the message to form proteins. Genome, genotype, and phenotype. These are observable individual characteristics of an organism. Note that genome and genotype are often used interchangeably. Cytochromes. These are enzymes that function as transfer agents. Cytochrome YP450 testing. Consider doing this testing with your client. It's relatively cheap. It only costs about $150. The advantage is it will tell your client and you exactly which drug will metabolize more quickly into their body. Mental health assessment. Scope of practice. Know your Nursing Practice Act. Psychiatric exam is used to identify the presence of psychiatric disorders. Neurological exams check for reflex responses. Typically, these are the cranial nerves. Cerebellar screening, Romberg test, equilibrium test. They test the sense of position in the body. Dysmetria test. This is conducted with the eyes closed. It's the finger to nose test. Limb ataxia test. It checks for incoordination and tremor test. Dyssynergia test. It's the disturbance of muscular coordination. Diadochokinesia test. Inability to perform rapid alternating muscle movements. Gait analysis identifies biomechanical abnormalities. Sensory function assessment. Pain test, sharp or dull. Temperature test. Vibration test. Peripheral sensation test. Stereognosis test. That's to determine the shape of an object with the eyes closed. Graphesthesia test. Recognize shapes drawn onto the skin. Motor movement test. Checks for extrapyramidal muscle movements such as Parkinson's. Diagnostic and lab testing. Thyroid function test for Graves' or Hashimoto's disease. Electrolytes test. Electrolytes are essential for pharmacological treatment. Calcium. Calcium is the primary cation for bone growth. Sodium controls fluid levels in the body. Hypernatremia. That's when sodium is too high. Hyponatremia. Sodium is too low. Potassium. Too much potassium is hyperkalemia. Insufficient is hypokalemia. Carbon dioxide controls the acid balance. Chloride, it's the acid and electrolyte balance. Triglycerides, these are the lipids or waxy fats. Liver function tests. Alanine transferase, ALT, converts protein to energy in the liver. Aspartate transaminase, AST, that increase indicates liver damage. Albumin and total protein, it's needed to fight infection. Bilirubin breaks down the red blood cells. Gamma glutamyl transferase, GGT, this detects liver or bile duct damage. Lactate dehydrogenase, LDH, it detects Hodgkin disease. Prothrombin time, that's the time it takes for blood to clot. Health promotion and disease prevention. Healthy People 2030. Take a few moments to look at Healthy People 2030. Some of the things that Healthy People 2030 wants to do, they want to increase mental health awareness, increase mental health treatment, reduce suicide, opioid use, and self-harm. Psychopharmacology. Pharmacology is the study of drugs. Pharmacokinetics is the absorption, distribution, metabolization, and excretion of drugs in the body. Pharmacodynamics is how drugs affect the body. Metabolism and cytochrome P450. These convert food into energy. Half-life. That's the time it takes to remove 50% of a drug from plasma. Pharma terminology. Potency. That's the amount of drug required to produce the desired effect. Therapeutic index. This is a quantitative measure of safety. Tolerance. It is the reduced reaction of a drug from repetitive use. Tachyphylaxis. Rapid, short duration, onset of tolerance. The PMHNP role in pharmacology. The primary role is to assess symptoms, consider the symptoms phase, what the family history is, what is the client's motivation, what are any contraindications with the meds, and any cultural implications. Most importantly, what is the benefit versus the risk of any medication? Non-pharmacological treatments. Psychoanalytic therapy. Cognitive behavior therapy. Multimodal therapy. Dialectical behavior therapy. Highly intense emotional people. Logotherapy is existential, searching for the meaning of life. Humanistic theory. Self-concept, interpersonal psychotherapy, and intrapersonal psychotherapy. Eye movement desensitization and reprocessing therapy. Group therapy has phases. The pre-group is where the framework and direction of the therapy group is determined. In the forming phase, members are reticent and fearful. In the storming phase, resistance and take over the group occurs with some of the clients in the group. In the norming phase, camaraderie begins among the group members. In the performing phase, group members help one another. And in the adjourning phase, preparations are made for ceasing the group. Gestalt therapy. Thoughts, feelings in a unified whole. Transactional analysis. Improve personal and social behavior. Experiential therapy. It's interactive and hands-on. Family systems therapy. Within any family system, whether it is at work or at home, there are emotional dyads and triads. Determination of self. Where does the client fit within the family unit? Family projection. emotional cutoff, multi-general transmission, sibling position and societal relationships, family system boundaries, family system homeostasis, structural family therapy. Strategic therapy is the influences family members have on one another. Solution-focused family therapy identifies the strengths and applies collective strength to find solutions. Complementary and alternative therapies. A complementary therapy adds to the mainstream medical treatment. Alternative therapies are non-mainstream therapy treatments. Traditional Chinese medicine, acupuncture, Tai Chi, and herbal medicines.